It is great to meet Angela Lennox. It is very rare to find exotic board certified veterinarians, avian and small mammal, and a woman who's going to be doing 8 hours of laboratory teaching and other presentations at the big veterinary conference in Orlando. So feel really lucky to snag you and to have the audience meet someone who, like Dr. Doug Mader, has devoted her life to these non-traditional pets. But you didn't start out being interested in pets. You were just interested in animals, particularly those that needed help. And you were just, can you tell the story? I think we all relate to being a child and seeing wildlife in jeopardy and not knowing what to do.
Absolutely. I didn't know what sort of animals I wanted to treat. I liked all of them. I liked horses. I loved this and that. And while I was considering going to veterinary school, I came across a deceased mother possum in the road with babies everywhere. I was like, oh, what do you do? You have to
Wow.
stop. And that's when I learned about wildlife rehabilitators, and the licensed wildlife rehabilitator looked at me and said, nope, you're going to be my assistant now. And so as
Wow.
a high schooler and early college undergraduate, I started rehabilitating wildlife. And when I went to veterinary school, I thought I was going to do critical care and be a cool emergency vet, but just kept getting pulled back to the non-traditional species. Met my mentor, and I practiced dog and cat medicine 1 year of my entire career. And the rest of
Wow.
the 30 plus year has been all exotics with loads of pro bono wildlife.
That is pretty lovely. And you have a thriving practice, the Avian and Exotic Vet Clinic in Indianapolis. If anybody lives anywhere in the Indianapolis area and owns a non-traditional pet, they know about you. You obviously must be very famous. But if you go to the website, wow, these board certified vets, and you have all of these vet students that are doing their residency, and you have registered veterinary nurses, which is rare to have in a vet clinic. It's really pretty much top shelf. Is it because those of you that care so much about non-traditional pets, you go the distance?
It's hard to say. And I didn't start out. I'm amazed at what this clinic has become, because my goal in life was to be a mom. I have four daughters, and
Oh my Lord.
I was going to have a side part-time gig as a veterinarian, which is a really high-paying part-time gig. That is what I was going to do. And so I did. I raised my four daughters. They were in the clinic all the time. They little teeny kids holding snakes. And I grew up in that clinic. And
That's
then I
great.
started, the demand went up, and AVMA statistics are showing exotic ownership is way up. So the demand was up, and the demand came up and up. And then as my children were in school and didn't need me anymore, you know how it goes.
Aw.
I started to do more and more. Then, as a kind of a late bloomer, went into the specialties through the American Board of Veterinary Practitioners. And the demand was there. Will you please teach? Will you please teach us? Will you please review these articles? Will you please write these articles? Will you please write these textbooks? When
Wow.
you get those kinds of requests, it pushes you a little harder than I would have ever done. And
Isn't that interesting? So it's the ownership, the pressure from the owner's side saying, we need you, we want you, and then other vets saying, we'd like to do it too. You need to hold the lantern and light the way.
yeah,
Isn't
well,
that interesting?
I learned from so many mentors, people that are went ahead of me that were doing this. And it was just a few, like Dr. Mater, absolutely. There just weren't very many of us. And there was only one conference and there was one textbook. And so in my 30 years some career, have seen this blossom into multiple specialties, all books all over the place, podcasts, websites, the whole bit. It has just exploded. And my one doctor practice is now five doctor practice, plus a sixth relief veterinarian that comes in. It's huge. I never planned it that way. Would never have thought I'd have 20 plus employees doing this,
That
but
is
here we
really
are.
extraordinary. Do you think also part of it is personality driven, that you have leadership qualities or some, no, really, who is going to attract that level of skilled vet who's gone to the extra trouble that you did, time, trouble, expense of being board certified in this subspecialty when it isn't even required, except for, that's why I asked, those of you who hold yourselves to this really high standard. In theory, a veterinarian of any stripe can see these other animals. There's a bit of teaching about it in vet school. And this boarded specialty is even fairly new to your field, isn't it? Relatively?
Relatively, although the avian was the first specialty, and that actually came about. I'm going to say this wrong, but I think it was in the 90s. So that was the first one. The birds led the way. Then I was on the committee to actually form the mammal one, and then came the reptiles, and then
Wow.
where things are happening. But yeah, as the demand is there, and as far as the personality, yeah, I always wanted to do something a little different. I wanted to be a little different. And this just naturally came. And the more you learn, the more you want to learn. If I didn't have all these residents and I didn't have these things, I'd probably be off in my garden and hiking in the woods. Which you try to do. You try to do, but maybe that would have
Yeah,
been a huger
that's what,
part.
yeah, the life work balance, how's that working?
It's better than it's ever been now.
Oh, good.
But when it was mommy and the whole bit, it was always a struggle. And we have to be honest and say it's a struggle. You're always trying to find that path.
Yeah. Yes, and I think that's why I'm asking, because a lot of people listening, and mostly females, are now becoming vets. Used to be such a male-dominated field, and we're always taught from childhood, although maybe the generation you raised and the generation your daughters will raise will be a little better at helping people understand how to have that balance and not expect absolutely 100% perfection in everything at all times of ourselves. And I think that's why Not One More Vet was formed, the NOMV, because of the high, not just suicide rate, but emotional stress. You can obviously be highly stressed to the point of debilitation, even way short of suicide. And we all just need to say it's really hard. And the reason I mention it is not just because a lot of vets and vet techs, and I hope future vets listen to this show, but also we who receive your care on behalf of our animals. I just think there has to be more gratitude and kindness and leeway shown to our vets. Do you find impatient clients crabby that they didn't get the appointment when they wanted it, or they were kept waiting because somebody else's amphibian needed you more in that moment than their appointment? Get pressure from the owners in a way that's not helpful.
Oh, there isn't a veterinarian out there unless they're in a lab somewhere that
Yep.
is not
Yep.
contacting the people that wouldn't answer with their resounding. Yes, we do. Absolutely. Fortunately for us, 10 to 1 are owners that are really grateful to have the care and they're fun to work with and we make friends with them and we feel really good about it. So that outweighs that. It used to be when years ago as a young veterinarian, when somebody called, well, back when I was a young veterinarian, there was no negative of, you couldn't put something on the website, trash
That's
people on the website. When we heard or got a letter back that said, this is terrible care, you guys don't know what you're doing and those sort of things, I'd spend a week recovering from that. And
I
it's
believe it.
terrible. A week. How
Yes.
could it be? And replaying it in your brain. How could
Yes.
you have done that
Yes.
better? And oh my gosh. And now, as a mature veterinarian, which I wish I could go back and talk to the earlier veterinarian, I give it a 5 minutes of ranting and really letting it go. And then it has to go. Unfortunately, I'm much better at that now. I wish I was better at that years ago, but we all have to do that.
We all do. And that's why I think it's important that we say these things out loud, because we can eat our own liver, as my digital marketing manager says to me when I'm trying to do maybe too much or do it
Yeah.
better. And she says, "You're eating your own liver." And I
Yeah.
think that's a kind of an interesting phrase, but it's what women do. We're trained to do it. And I'd love to think that the clock has moved forward and everybody's more equal. There's more equality in the way the sexes are treated by their parents, because that's really what we're talking about. We're not talking about job equality, even. We're just talking about what we expect of ourselves. So, your four daughters, are any of them going to become vets?
No, but
Wow,
the
that's
three,
amazing.
it's interesting. One started vet school and then and realized that it wasn't for her, and now
Oh,
she's got 5 babies. So she's doing the full on mom
holy
route, which is
cow.
great. That was fine. The other three, all one's a nurse, one is a co-owner with me of the practice
Oh,
management,
nice.
and the other works for us and does all our video and design. If you went to the website, saw the movies and the design,
You're
that's all
extraordinary.
her. She's amazing. So
So
yep.
really, two of them have stayed close to the
Mhm.
center pole
Have.
of the tent. That's really, yes, you have, to anybody who wants to see up close the things that we talk about a lot on this show on exotic pets in particular, how to look after a bird, how to feed fish, how to take care of reptiles. You have incredible videos free to anybody on the Avian and Exotic Vet Clinic website, which is a beautiful website. That's why I was like, wow, this is fancy. And yet you started out worrying about eight baby possums on the side of the road. That's what
Yeah. Yeah.
inspired you.
This daughter, her name's Katie, she's so talented and she puts all that together. But it was a lot of that was the what's on that website was very selfish. And that was during COVID when we didn't have face-to-face education opportunities. We made video after video so that we could just say, look at this. This is how you're going to do this. It was COVID.
Oh, that's fabulous. And then it means that you have a much better now without COVID and the ability to see people, but not to see them maybe immediately when they want to be seen or they just got a new exotic pet and they've listened to what I tell them, which is you got to see a vet first off because you don't know the health or illness of your exotic pet. It's not evident to you, but it will be to a vet. They need to get a wellness check. How great that they can inform themselves and be a smarter, better owner and a
Right.
better, smarter client. So, what about wildlife and
Yes.
rehabilitation? I've never understood that when I lived in East Hampton, people would find a duck or some other waterfowl on the beach, maybe with an injured wing, and they'd bring it to the vet's office. And somebody who was a licensed rehabilitator would then, it would go off into this secret place where somebody rehabilitated it. But I never really knew what the process was. And what should we do if we see an injured animal?
Right. So every state has legislation and laws about their wildlife, but waterfowl and migratory birds are federally protected. So that's a level of
Oh,
federal. So those are the regulations, and they make a provision for what happens to these injured ones, and that's the whole wildlife rehabilitator, which you can be rehabilitated as a state or federally. And the veterinarians help those folks. So it was natural for that to be our pro bono, which everybody needs to give back. And ours was pro bono. So we never charged for care of wildlife. Wildlife is overwhelming our clinic. So
oh
as of January 1st, we started a new nonprofit called Rewilding Indiana to support a full-time or part-time moving to full-time wildlife veterinarian to do nothing but that and with
my.
our rehabilitation partner. So I'm now
Wow.
a nonprofit director.
Yeah, because you didn't have enough to do. And running a nonprofit isn't a lot of paperwork and a lot of oversight. It actually is. And legal documents. Rewilding Indiana, isn't that a wonderful idea? I remember once I was riding with an instructor years ago in Southampton, and we were cantering around a field, myself and two other people. We were going over some jumps. And I said, "Oh dear, a baby bird." Now, in my world, because I guess maybe, what am I, a tough guy? I'm like, this bird fell out of somebody's nest. There's not even a tree very nearby. I think we should just put it out of its misery. That's what I thought we should do. The trainer scoops up the bird. It was a tiny baby bird. He leaves us in the field to our own devices. We knew how to ride. We were skilled riders. And he drove over to Old Town Animal Hospital. And I thought, is that just an exercise in futility, or should we try to save little tiny baby birds? And at what point? So, do people come with tiny unfeathered birds that are just look like little peeled things and say, make this well?
They do. They do. And the thing is, most wildlife, though, maybe didn't need help. And that's where, if you go to any of the wildlife rehabilitators or our Rewilding Indiana website, it'll actually clearly explain which ones need help and
Good.
which don't. And then if they do, then yeah, they can come to a rehabilitator, one of our rehabilitators if they're not injured, or they come to our hospital if they are injured. So yeah, there's a lot of that. Yeah.
There's a lot of that, and that is what your pro bono and what your side mission is. Your side gig
Side
is
mission.
we're going to not let any wildlife die that doesn't have to, even if it's part of nature. I grew up thinking that's nature. Not every bird's going to make it.
Well, we're not going to see a lot of things, but
Right.
if it's, and a lot of this honestly is a service to the public. When you as a member of the public encounter this injured or orphan thing, you can't pass by. Most people can't. They want
Right.
a thing to do. If we stay within the law, we do exactly what the law says, which means if this wildlife can't be rehabilitated to go back to the wild, then they are euthanized for the most part. A few might go to education, but not many. But it's people don't want to walk by these things.
So it is a service, an emotional service to
It
the
is.
humans, and not
Gotcha.
always or often actually saving the animal. We don't know. Every situation's different.
You say you rehabilitate a big group of raccoons. Do we really need more raccoons? Does conservation say we need more raccoons? Not necessarily, but it's hard to walk by them.
Yeah. Yeah, it is a complicated sort of question. So do
Very.
people who have exotic animals, they view non-traditional animals, which I guess is wildlife also differently, especially the avian ones. Now, the other day you had a big surgery when we were first going to do an interview. Was it on a bird? When you have a big surgery, what is it that comes in? Is it an owned bird? I hope if you do a big surgery, it's on an owned bird so that it continues its life with somebody.
Yeah, usually on my surgery days are packed full of very complicated surgeries because honestly, people are trained out enough to be able to do things that are easy. So my surgery day is generally referrals from other practices, including one on 2 days ago that came from Canada. Um,
No kidding.
for a surgery, which through no brilliance of my own, but the fact that I had nowhere to send anything to, had to try. Okay, that worked. Try again. Okay, that went better. Try it 4 or 5 times. I got this. And these are the kinds of surgeries that people generally referring us to do. But I would say on an average day, most things are not even from Indiana. They're from out of state.
So can you describe that surgery, who it was on or
Yeah.
what it was on and what you had to do? For the lay
Yes.
public, obviously.
Public. And the ones in particular that I seem to get the most are dental abscesses.
Oh,
And these are rabbits, and these are complicated because the abscess tends to act like a cancer and destroy bone. And so you generally now are doing an orthopedic sort of a surgery to get to access and to fix that. I evaluated one yesterday for chronic rhinitis, a nasal cavity infection that had gone on so long that our CAT scan, and I have a CAT scan in our clinic now because it's so valuable. It's so
wow.
valuable. Showed that this rabbit has no normal nasal cavity anymore. And the only way I can fix that would be if the owner decides to make a small opening and clean it out. But and then ear surgeries, the same sort of things like that.
So this owner comes to you and are they like watching Grey's Anatomy? Are they sitting in a waiting room for the doctor to come out and say, here's what we think and what do you want to go forward with?
Usually they come with the doctor, the referral doctor already having an idea what's going on.
Oh,
So we get the CAT scan. And then what I love to do is have the owner come back with me because when you see the cat, I can explain all this CAT scan, but my CAT scan will turn the images into a 3D. And
wow.
now we can look together at the 3D model and I can say, here's the normal side. Look at this. I have to do this. And when you see that, it makes it so much clearer than the doctor saying a lot of complicated stuff. Now the
That's
owner
good.
kind of understands this is what we need to do. Here's the risks. Here's the benefits. Shall we go? Shall we do it? Or shall we do the next best, which would be management? And then the one level below that, let's talk about palliative care and
Right.
hospice. And those are words that we're using for veterinary patients now. So we're not a failure. We're offering a care, but it's hospice and palliative.
Comfort, comfort, pain relief with the expectation that death is not far off.
Or they're not going to fix this. And with an understanding that when we get to the point where the suffering is not manageable, euthanasia
Right.
needs to be on the table. We need to talk about it.
All right, so you've talked about two pretty dire rabbit situations. One is dental and one is I don't know if the nasal cavity is a big issue generally in rabbits. Are these
Huge.
It is.
Hmm.
So are these things that an astute, alert owner would have seen symptoms or signs of and if they had known what they were looking at should have come in, which isn't to victim blame, but I'm saying are these avoidable, these dire end of the road situations?
I think if there, in a lot of cases, if there was a lot more awareness of exactly what happens on the part of the owner and the referring veterinarian, or a lot of referring veterinarians don't know there's anywhere to send these things.
Right.
So if all those things came into place, we identify it early, the veterinarian goes, "Ooh, I've read enough to know that this is could be bad if we don't do anything, and there's things to do. And oh, here's a person, let's go, let's refer." That's the best case scenario. And then we can get, because we're doing the CAT scans now way earlier on patients that we're seeing. If we see a rabbit that comes in with nasal discharge and we couple rounds of antibiotics based on the correct called getting better, and it's still not getting better, that CAT scan is going to come up real early in the conversation with us because we've gone down that bad road and we know what happens.
So this is one of the things, and ears are a big deal in rabbits as well.
Yeah,
These
they
are
are.
things that if you're going to be an owner of that non-traditional pet, you have to be on top of it because otherwise you're looking at a dire situation. It's not like a dog with dirty ears or a kitty with ear mites. I suppose even those could go really long and then become more than chronic, become an emergency. But
Sure.
I think,
Anything, any ignored medical
yeah.
problem can spiral out of control for sure.
But do you have wellness visits with any of your patients or new patients to check
Yeah,
them out
we
regularly?
do.
Good.
Yes, we do. We love wellness. Prior to COVID and way before that, we felt that good 30-40% of what we saw was wellness. When that whole thing came along, we stopped seeing wellness because we couldn't
Right.
manage. And it's creeping back in that more and more people are doing wellness. But I don't want to call us a referral center, but we are becoming a referral center. More and more of what we're seeing is things that people are sending us from other veterinarians, which is fun. It's fun and exciting and challenging. And that's how
Yeah.
we educate our residents. We have 4
Right.
residents right now, and that's how they get, the baptism by fire and drink from the water hose, fire hose.
And they
Yep.
will eventually become exotic vets, or they're just being residents to decide whether or not they want to go the route of your specialty.
No, they're in a residency to become, we have 1 avian and 3 exotic companion mammal specialists.
That's
They are
pretty
here to
great.
do that. And
That's
then
so great.
once they complete that, then they take their very ugly test, long, and they've got publications and many other requirements. When they get all those things done, then they are specialists. And at this point, boy, I need to count again, but I think we have at least 10 specialists, we've graduates that are now specialists. And
That's a lot.
I think so. I
When I
do. I
first
was
started
surprised.
exotic pets with Dr. Doug, there were, I'm making up this number, I think there were like 60 board certified exotic specialist vets. That's very few. It's like the behaviorist vets, 100 in the world. Maybe now
Yeah.
there's 106. It's really important that you guys are doing work that really needs doing, that other vets need you to do to back them up, but also to inspire new generations of veterinarians and vet techs and vet nurses to do something that maybe to them is more challenging, more interesting, more exciting. And like you only spent 1 year with dogs and cats, you're like, nope, that's not my calling. My calling is the non-traditional.
It
Angela
was.
Lennox, it's just great to meet you. I'm really looking forward, I hope, to being able to watch some of your hands-on work at the veterinary
Oh,
conference
yeah. You'd be
because
most welcome.
it's fascinating what you can do with these little tiny animals and these little tiny tools to make them well. It's wonderful, as well as neuter and spay them. That's pretty vital too. We
Sure
don't need,
is.
if we don't need more raccoons, we know we don't need more bunnies,
Yeah.
pretty
They're great,
much.
great pets, but we need the right amount of them.
That's right. And managed with a healthy breeding program, whoever's breeding them, so that
Yep.
all the babies come out and have a good chance at a good life and maybe don't need the vet so much other than for wellness. Thank you
That's
so much for your time. Thank you for your
Tracy.
years of passionate care of all these wonderful, I'm not going to call them peculiar, different, exotic, interesting animals. They're all grateful for you. Thank you so much.
Thank
Look
you.
forward